might be on, but I'm not sure. So this is a difficult time of the year because everybody has all kinds of things they're working on during the holidays. So thank you so much for joining us. My co-convener is on. From where are you now, Representative Hashimoto?
I am on Maui, so
Maui.
it's in the state.
In the state, yay! In Japan, and I don't know where else have you been. So thank you for joining us. So what I'd like to do, if it's okay with everybody, we have people who have proposals, because today was a day to present your proposals for the Kupuna Caucus to hear and to mull about and define what they want in terms of our agenda for the legislature in this coming session. We have 5 bills limit, but as the Kupuna Caucus has done in the past, we go forward with all the bills, but we have priority bills because the House is limited to 5. We have 5 priority bills. So today, we have urged you all to send in, or if not send in a draft, at least be able to give us the justification and the description of what the bill you're proposing is going to do to address an area. So I'd like to start with the working groups.
But yeah, well, she's pulling up the other one.
So if somebody is not on mute, could you? So if you're not speaking, then could you put yourself on mute so we can hear whoever is speaking? Thank you. Thank you. So we're going to start off with the long-term care. What started off as the Council of State Government long-term care project, and some of that also led to some state issues and projects that we might be able to look at. So I'm going to start with the working groups if they have any proposals or can give us an update of where they are. Some are going to be continuing on because these are really complex issues that we need to address in their long term. But at least if we can start the effort, we can move on and see if there's anything to do this year. And if not this year, then next year, but at least we'll keep the groups going because there's a lot of interest and a lot of expertise in these groups that we don't want to lose before we get to the end point. So with that, I'm going to ask, is Judy Moore Peterson on? Okay, she's not. She wanted to.
Yeah.
Okay, so Paige,
I can represent. Yeah.
Okay, so Paige is. Yeah. So we're going to go through. There are 4 working groups. One was the cost of long-term care. Another was the quality of long-term care. That's a continuum of long-term care. Another was workforce development. And the last one was on guardianship. So I'm going to start with Paige on the cost of long-term care. If you could give us sort of where you are, and if you have any proposals, and then where you are.
Sure. Thank you, Senator. And I think Judy does wish she could be here. And I always like to hear from Judy. I think she's got a really good grasp of the larger system. And I always appreciate
so
that.
Is Judy on, Paige, or should we wait?
I don't think she can make it today. She had asked Robert and I to present on her behalf, but I think Robert might also have a conflict. So
and we could hear from you next time. So, give us the kind of the synopsis and then we'll come back to it.
Well, I'll start with our proposal, and it's a proposal that we have worked on for about a decade, and the legislature has passed for the past decade, and it's something called the provider fee bill. There is a program that essentially allows nursing facilities to impose a fee on themselves. That fee is then used as the state dollars to draw down additional federal Medicaid dollars. And why that's helpful is it allows us to use a non-state source of funding to get, maximize our federal drawdown. And it helps us bridge the gap between what Medicaid pays for services and what Medicare pays. So it doesn't take us up to cost, but it does really help us in terms of the nursing homes to be able to hit a little bit more financial sustainability. So that's a program that we had in place since 2012. For a long period of time, we were authorizing the bill every year. And then we went to a 2-year authorization. And part of that was just to make sure that the nursing homes were comfortable with it, MedQuest was comfortable with the program, and the legislature was comfortable with the program. And I think we've shown a lot of success over the last 10 years. So we are going to be requesting that the program be made permanent. So that is a big change for us, from going every 2 years to coming in and asking to making it permanent. And that's why we did want to bring it to this caucus, because it is a major change for us as HAH, who too are big supporters of the bill, but also for MedQuest. And I think one of the other things we're hoping with that is by taking that bill off the plate every 2 years of doing that, MedQuest and HAH can also focus on other initiatives that would be helpful to supporting the long-term care industry. And I think as a segue, one of the things we're talking about, and Judy and her team are working on, is this case rate study, or the rate study. I know that she had sent an email recently saying that they will likely have at least preliminary results for that rate study. I think probably in a week or two, and we'll have those available for us to discuss further during the legislature. So I know one of the things Judy has said is that that rate study, I think, will be helpful as we talk about the sustainability program. Oh, hey, Judy. But I think going forward, what it all looks like. Go ahead, Judy.
Yeah. Judy, thank you for joining us. I don't know where you are, but thank you.
Yeah, you're welcome. I moved some things around so that I could attend.
Thank you.
But Paige did a great job of outlining the sustainability bills, and actually also the rate study. Just as a quick reminder as to what we're studying in that rate assessment and the rate study, it's focused on a few key home and community-based services, in particular community care, family foster homes, CCFFHs, as along with expanded adult residential care homes and some self-directed, as well as case management agencies. And then we have a phase 2 planned for that would be initiated in the spring for other home community-based services, such as some of the non-residential ones, such as adult daycare, adult day health, and off the top of my head, those are the ones that I can recall. Oh, I think there's also some personal care that's included in the current rate study. So we just saw some preliminary results, I think yesterday, just yesterday I saw some preliminary results. And then they'll be here, the actuaries who are working on the study are going to be here next week to meet with stakeholders, to meet with us about presenting what those results are. I don't think it's going to be too surprising, but compared to where we are and what the recommendations are, it's quite a bit more. So the other thing that our team's working on is coming up with some options of how much it would be from a budgetary standpoint to change our rates to be at that level, at either the maximum that's being, if you threw in everything, what it would be for a more moderate increase, and then a bare bones increase, just so that the legislators have some options in front of them.
Thank you. That's great. Great news. That's almost done. At least phase 1. I'm looking at phase 2 too, because of the community-based stuff. But right. Just in terms of the timeline. So if in fact we have all these recommendations, max, and what we need to move at least a little bit. What is the next step? Is it the ledge approving it, or can you get federal funding for it, or is it our match and the federal will meet, or how does that work for the next actually doing it after the study results come out?
Yeah, after the study results come out, we would need to work with legislators to put in front of all of you the budget ask, and the budget ask would be for both new general fund, state fund dollars, And with everything that we do comes with both state funds and federal funds. We would, of course, if we got approval for more money, because this will take more money. If we did get more money, then we would then go through the process that the more administrative processes that we have to go through to get CMS approval, et cetera, to make those changes. But that's the first thing that we would have to do is to secure the money that we would need in order to pay whatever sort of rate increase was the legislature thought that they wanted to support. Kind of I would pull up the recent provision expansion of the adult dental benefit as an example. Like we put forward 3 different options for legislative consideration, and we included that also in a budget ask. We didn't include this in our budget ask, but we included adult dental, and it came through as a bill, and then there were different options, and the legislature actually chose a higher one than what we had initially put forward because there was additional money available. And so I think from our perspective, we would approach it in a very similar way. It's like, okay, what do you think that you can afford on the long term? Because it's of course not just what needs to be sustained during the good times, but actually what's going to happen, when our budget isn't so robust.
So to just clarification, so if the legislature said this amount,
Mhm.
and then you took it forward into CMS, and then they would also fund, is that a match or is it, what portion of that do they pay so that we can?
Yeah, it
expand?
works, Senator, it works like any other Medicaid service. So there's nothing special about the home and community-based services area, but all Medicaid services, all dollars that are used for Medicaid services, every dollar that is spent on a service like that gets paid to either managed care plan or gets paid to a provider, it's made up of state funds and federal funds. That's just how the Medicaid program is funded. And so when we're coming to the legislature and saying we need this amount of money, we're asking for the state fund portion of it, and then because it is a Medicaid expenditure, it automatically comes with whatever the federal match is at the time. So from a provider perspective, they don't know that 47% of it is general funds and 53%, if I'm doing my math right, 53% is a federal dollar. They just see the dollar, right? But from a state budget perspective, part of it's going to be the state fund portion and part of it's going to be the federal fund portion. And that just comes once we get approval and once we start making those expenditures, it's automatic to get both the state fund portion and the federal Medicaid matching portion, as it is with any other Medicaid service. Is that helpful?
That's very helpful, yeah.
Okay.
So Paige mentioned the first bill is the provider fee bill, but is there a bill that you need at this point on your study, or is that going to come next year? It would be nice in the first year of the biennium, but I'm not sure that you would be ready, or what would you come forward with?
Yeah, we wouldn't be ready, and we didn't because we had no idea how much would be needed. So we currently don't have a bill, but going and there are opportunities going through the budget process, as you go as we present or as the budget gets heard with finance and then with ways and means, there are opportunities to add money, line item monies that get added in that say, okay, this is for this is for that. And so there's that opportunity. from a bill perspective, as far as putting forward a bill, it's too late for us to put forward a bill. And so legislators could put forward a bill. And then the other way that would be more sustainable and long-term, because it would make it into the base, is to get it added into the base budget as the budget bill is being considered in both finance and ways and means.
Okay,
Is that helpful?
yeah, it is. And then
Okay.
if you can keep, so come back to us and let us know where you are in the process, but yeah, that'd be good. Thank
We
you.
have to, as part of what came out of the last legislative session, there was I think it was Senate Resolution 4, maybe. So it's on the Senate side, which requested us to do a rate study and then report back, which is why it's one of the reasons that, we were already working on it, but we'll put it together and put together that report, and I'll be sure to share it with, I'll make sure that I send it to you at least, Senator. I can send it to the Representative Hashimoto as well.
That would be helpful,
Yeah.
And we can support some of the recommendations, hopefully.
Yeah, and once we know who the subject matter chairs are and who the finance, of course, we know ways and, well, I think we know
Yeah,
who.
the Senate is pretty much set, so.
Yeah, so,
Joy, Senator Sanborn and Jura, and then Ways and Means is still up, so.
okay.
I
So
don't know how side is it.
yeah, we'll share it with them as well, and then we'll share it with you too, and then you all can, we're available and happy to have those conversations.
Okay, good. Thank you. Thanks so much.
So Judy, what did you say the timing was again?
For which part of that?
The initial rate study.
Oh, we're in the final stages. I hope that we can get a draft report by the end we're in December now, by the end of December. No later than the end of December. We'll have a report that we can, so that we'll have the results. And the pieces that we're working on right now is one, to finalize how much it is, what the recommendations are from a perspective as far as changing it. And then we also have to price it, because we don't have anything to price yet. So once we have something to price, we'll price that. We'll include that in the report. That should be ready to go by no later than the end of this month. And I'm hoping that it'll be sooner than that.
So just to clarify, you said it's home and community services, family foster homes, and adult residential care home and care home agencies.
Yeah, and case management agencies,
Okay,
personal care services, and self-directed services.
Okay, self-directed services too. Okay.
It's
Very good.
services that are in the home that help people stay in the home, or in a community, in a residential setting.
So the only thing that's not in there now is the day health and daycare.
And there's some other types, those kinds of services that, where you would be, community-based services, but they're not residential. I off the top of my head, Senator, I'm not remembering what those are, so I do apologize, but I can quickly get that for you.
So at least we know that the whole thing is, looking at the community base, especially.
Correct. Yeah.
Okay, great. Thank you so much. And thanks for coming on.
Yeah, I'm glad I was able to move things around.
Yeah, no, this is important, Judy, because I think we have a lot of new members who are on this call today. So I think it's good for them to hear. Many of them may be on finance committee as well. So, I think that is good information for them to have, especially if we're going to expedite some of the asks this year. So I don't know, Senator, can I introduce maybe some of them? I think a lot of them are elect members, right? So we have Rep. Kanani Souza, who's here, Rep. Jackson Sayama. I saw Rep. Kelly Cochran is here. Rep. Garrett is also here. Rep. Takino Uchi and Rep. Lamasao is also here. So thank you all for coming. Look, we have such a force coming up from the House.
Yeah, that's great.
To learn about
That's
what
great.
we're working on here. So thank you guys for joining. Many of them are members and they just joined Kupuna Caucus. So I really appreciate you being here.
Great.
Thank you,
Thanks.
Representative. We look forward to working with all of you. And if any of you have questions, we're happy to spend some time going over this with you.
Yes, and also I forgot Rep. Corey Chen is also here.
Oh,
So
great.
welcome, Corey.
I don't see any of my colleagues. I think sorry, you just have me.
Thank you, Senator. Okay. Thank you, representatives. We look forward to working with you, as always, on the sustainability bills, of course. And then we'll provide you the information on this particular really important rate study. There's lots of other budget items within the Medicaid world that I'm sure will be coming up, but we'll cover those with you as well.
Great. Thank you so much, Judy.
Thank you.
Thank you, Paige.
Not too dirty.
So let's move on. Next, I think we have
Did you talk to her?
who's ready?
Amber.
Okay. Who was that? Caroline? Shall we do workforce? Caroline or Maricar?
We can't hear you, Caroline.
Maricar Peloton Fergus from Department of Labor.
Yeah, we still can't hear you, Caroline. Nope. No? Okay.
Testing.
Yes.
My
Okay,
apologies. Good afternoon, everyone. Caroline Cuddy-Rao here, Executive Office on Aging. And our workforce work group, we have various strategies that we're going to be working on over the next year, but we do have a request of the caucus. And this is for, the purpose is to support ongoing training at the community college level by providing a state-funded scholarship program to 30 students annually statewide. And this would be for students that demonstrate financial need and the propensity to succeed in healthcare. So our ask is for $160,000 annually, $100,000 to go towards scholarships and $60,000 to manage the program at the Department of Labor and Industrial Relations. And I'm available for any questions.
okay. Any questions? Okay, and that's your one proposal, it'd be a budget bill for the scholarship program for ongoing training.
Yes, this is out of our
Is it-
workforce work group.
Is that going to be a proposal, a bill, or is that going to be in community college budget, or what's the intent?
We were just intending to put this forward as an item to be voted on.
Is it going to be a bill with appropriation, requesting
A bill
appropriation?
for an appropriation, yes.
Senator, this is Maricar. Just to give a background, currently the colleges have funds under the HANA Career Pathways, but those funds may be expiring in the near future. So we wanted to be able to continue that, and many of the students may not be able to afford the current tuition of $3,000. So that's burdensome. So we wanted to be able to provide that opportunity to continue that process.
So is it 30 students and the $3,000 per student for tuition and
Supplies, and so that would be statewide.
okay. Okay,
I
any
have a
questions,
question.
anyone?
Colin,
Colin? Dr.
I
Holly should ask.
wanted to know whether or not this is just for matriculated students or undergrad students that perhaps are interested in taking courses that results in a certificate, for example, as a certified nurse aide that the community colleges have, or other courses that do not necessarily result in an AS associate's degree.
So Maricar,
I
yes,
can respond,
my
can I?
understanding was it was for the CNA program.
Yeah, so it wouldn't normally be an associate's degree, but it would allow them to test for the CNA license. So it's more short term.
So is that the focus then for CNA focus type of training?
Yes,
Okay, so it's clearly for aging and disabilities level workforce development.
The CNA to help support funneling the shortage in that industry.
All right.
So some of the students may not be able to afford that. So we thought this would allow them the opportunity to pursue an occupation, to begin a lattice in the healthcare industry.
Because I'm not sure if the CNA curriculum course requires an entire semester. It's about 100 hours and it's probably less than 3,000. In fact, there's many CNA type courses throughout the state. And I think the going rate is about $1,000 for the course.
I think currently Leeward is on the call. It's $2,900 right now for their tuition.
If I can,
In the state system?
Yes.
We wouldn't charge them anything. We didn't charge them anything.
I can't hear, good. If I could make a comment, 3,000, there are a lot of CNA training programs out there that are a heck of a lot less than $3,000, and they last maybe 1 to 2 months. So that makes it easier for people to get out there in the workforce faster. So I'm wondering if you're focusing on the community colleges, if that would be open for students that aren't going to community college but want to go to a quicker course, would they be able to apply for that scholarship? And they don't need the $3,000.
And can you answer that, Caroline Maricar, either you or Caroline?
Senator, yes, we were just basing the tuition on what's currently offered. So it could be higher or lower than that.
So it'd be open, not just the community college then for this
Yeah,
training.
I think the details too is something that we can still massage, Kathy. So,
Okay, thank you. Kurt?
Yes, I had a question. Would it also involve OT and PT students that currently go to KCC? Because there is a shortage of all healthcare professionals.
When we developed that proposal of 30, it was really to brainstorm on the current shortage in the CNA. So I think it was a way of enticing the population to address the current shortage in that industry. So we can definitely expand our proposal to include other industries, but at that time it was just mainly to address the long-term care and to help funnel some of the students in that field.
Okay, thank you.
So just a clarification, then who would be the administering agency in this proposal?
Senator, that would be the Department of Labor, since we already have the processes in place.
So you can expand it then. You give some to the community college, some to those organizations that Kathy talked about, and that it could be broadened to look at healthcare for the Kupuna and disabled.
Yes, correct. Because right now we do have exemption from the State Procurement Office because we do administer federal grants, and it allows, it's really customer choice based on the data that's on the website. So each of the clients that's after, of course, an assessment that they're interested in pursuing training, then they decide which of the training providers that's available online, which ones they would choose. So like I said, the tuition could fluctuate.
So DIR will be kind of overseeing it in terms of the certificate programs that might be out there, like Kathy's talking about, as well as a community college and the areas, the disciplines, whether it's PT, OT, or CNAs. Okay, that sounds good, the flexibility that you folks have at labor. Any other questions? And you can give your input to Maricar or Caroline as this bill goes along. Because even if you're not in the high five, you know, it really should be developed. So we will support you in whatever efforts. Yeah. Okay. Anyone else with comments or questions? Okay. I'm gonna move. Any other proposals that you have in workforce development, or want to give us a report on status of what you're doing?
Needed. No,
Okay.
they're talking softer. It depends.
Okay, anything else you want to report on workforce? Okay, yes, no? Okay,
Senator, that's all we had.
okay, thank you.
Thank you.
The third is the continuum of quality care. I see Kathy, I don't see Wes, so Kathy, you probably are it.
Yeah, I'm it. Okay. Well, you mentioned last time I was not able to attend the meeting, but our thought is to have a pilot program to follow people through the continuum of care, to see the most efficient use of the different services. I'm sorry, but there's so much organizational stuff that has to be done yet. So we're not near a proposal and money ask yet, but we want to continue working with your office and develop that further, get the organizational part of it, get all our goals and costs down, and then we'll be ready next year.
Okay, good. Thank you. And thank you for continuing to work on it, because this is really important for the whole long-term care system. So thank you very much. Okay, so the next and not the last, but guardianship is Gary or Dantrion. I know they had some bills. Oh, Jay. Jay from Developmental Disability Commission. Jay Silver, are you presenting?
I think I'm giving the little spiel, yeah. And then
Okay.
Daintree will add in anything I miss.
Okay.
Okay, so hi, my name is Chase Silvert. I'm the Legislative and Community Liaison for the Hawaii State Council on Developmental Disabilities. In the off session, we've been working on looking at guardianship and kind of what issues the different populations that have guardianship face. We particularly represent the developmental disability population, but we created a stakeholder group so that we could try to kind of capture the different issues that are kind of facing the entire population that use guardianship. And so the two main things to highlight when it comes to the issues our state kind of currently faces when it comes to guardianship is, one, we have a overuse of full guardianship. And so currently the way our state laws are written and the way that it has been done, we kind of incentivize just going for entire guardianship or full guardianship rather than a conservatorship or a limited guardianship. And this is because when you go for a full guardianship, currently you don't have to do basically like a capacity study of the individual because you're taking full guardianship of them. And so it's actually easier to get that because you don't have to do the capacity study. When you do a limited guardianship, which does not require as much use of the guardian for certain things, you have to do the study, and it's very cumbersome for some individuals to do it. So they just go for full guardianship, even if it's not the appropriate thing. And so the other thing with conservatorships is conservatorships are only for individuals that need help financially. When you go for guardianship, you lose things like your right to vote, your right to make decisions on where you live, where you work, who you can marry, and all those kinds of things. Where in a conservatorship, you could still make most of those decisions. You just don't have necessarily complete financial control. And so having these alternatives is actually a good situation for most individuals that look for guardianship. For example, with the elderly, a lot of times they just need limited guardianship and or conservatorship because you want to really keep the capacity of the person as much as you possibly can. But our way our current law is written, it's kind of the opposite. It's take everything away and then see what you can do. And so on top of that, what we do hope this will lead to is alternatives to guardianships, but we wanted to work on this first and really get guardianship itself squared away. The other part of it as well is that we were looking at using a uniform law to try to kind of update our current state laws. In Hawaii, we adopted guardianship in 1997. We only have done one update since, and that was in 2004. And it was a very small update at that. And so we haven't really updated guardianship in quite a while. And something else that we do hope with this uniform law that we can update is that there's some archaic language, like we still call people that adults that need guardianship, they're labeled incapacitated adults, which is not really great. And on top of that, it's just really a big modernization push. It makes the process itself better. It pushes for, limited guardianships when necessary. And it really tries to emphasize the person first and their capacities first. So rather than stripping them of everything, we really try to work with the best that we can with the person. And so I just wanted to keep it brief. And Senator, I can go over more details if you would like, or Daintry, if I missed anything you want me to tackle.
So you're going to come in with a big bill, like an omnibus bill. It's going to be a just sort of replacing the current old guardianship bill completely. So it's a big bill, and you know, probably will have some vetting, and people need to do the whole bill at some point. But the concept itself of something that's been there from 2000 and what is it? You said 1997. You know, it's over 30 years. So I mean, we really needs an overhaul. But I don't know. Maybe some people have some questions about what it is, just kind of generally, and then where there's interest in that, and then you can get the link to the actual bill that we have, the uniform bill. Any questions of Che on the guardianship bill? This will be the whole uniform guardianship and conservatorship bill that would come in intact. And I guess at some point you'll need to say, this is what's in the old bill or the current bill or current law. And this is how it's changing. I mean, I know that there's so much because I know I've seen that big document.
Yeah, we will be working on a crosswalk when the time comes. So we'll be able to share that with people.
And especially for the legislature as well, because when you've got this huge bill like that, it's good to know what are the major concepts that are being changed. And, you know, a lot of these things are, like you say, archaic language and so forth. But
yeah, out of the 250 pages, we'll be able to do a crosswalk with the ones that are really changing.
Major substantive. Yeah.
Mm-hmm.
Any questions? Okay, thank you. You had any other bill? That's it.
That's it that we'd like to bring to your attention. We know that the Kupuna Caucus is very narrow. I mean, you guys have we are looking at the possibility of doing more trainings around guardianship and looking at Act 69 that came out 2016. And this was regarding when someone's discharged from the hospital, the caregiver is informed. But we also want to put a caveat, number 5 in there, to make sure that the caregiver understands guardianship and surrogate decision-making when they pick the individual up, because if they're being hospitalized, there's a chance that one day they're going to be incapacitated of some sort. We want to make sure we set up alternatives to guardianship as early as possible and really do some better training and educating. So we're still working on that, Senator. So I don't want to waste your guys' time on that, but that's something that we're looking at.
Good. Okay, thank you. I think it was Dr. Hayashida.
Senator, I just wanted to inform you that we sent a memo to your assistant, Charles Izumoto, regarding the possibility of a bill having to do with the kind of work that Kapiolani Community College was doing several years ago with the Kupuna Education Center that has since been closed. The work that was done was very much in line with this whole idea of building the workforce development effort for elder, the growing elder population. So it did have a section in there having to do with home care workers. And then we also had another section in there on personal care assistance and companion aids, family caregiver training, and active aging. In any case, there's a proposal that was suggested in that email, and it is possible to put something together, I think in relatively short order, because much of the work, at least the structure of it, is in place. So I would think that this is something that the legislature would want to consider to possibly resurrect this whole effort, since this is not going on.
I don't have that email, so maybe you can resend
Okay, we will.
and then we'll
It
come
came
around
from
to it.
Kendi Hall, who was working with
Kendi
me.
Hall. Oh, yeah, I did see something from Kendi Hall.
Yeah. So,
Okay, then, I want to just finish up and start going through these bills. So I think if I can just see, there's nothing else from.
yeah.
Senator, I see something from a Roxanne. I'm not sure if that's to us or not. Roxanne Larson has a hand up.
Yes.
Roxanne,
Hi.
Roxanne, hi.
Hi.
Is it related to guardianship?
Yes, I wanted to ask, this is something that faces a lot of Kupuna, and that is when you have children that are disabled, like I have a disabled son who's 50, and I want to, in my trust or will him a place to stay. However, there's supposed to be a way that you can put it in, conservatorship or something, so they don't actually own it because he has Social Security. There's a lot of Kupuna who have this problem. When they pass, they want to give their children, their adult children, a place to stay that have disabilities. Does this bill cover stuff like that? And where can I get more information? Because I'm not the only one. I know other Kupuna, they're going, oh my gosh, when I die, I want to make sure my kid has a place to stay.
Sure.
This bill will help with the language that's being used within it, but it won't necessarily directly affect that. That's something we'll have to come back, and that's more along the lines of trusts that are set up. And so that's something that we can look into more and get back to you guys on. But we'll have to double check those areas. We haven't been asked that question before, so let us talk to the experts on it. I don't want to misspeak at this time, but it's my understanding it clarifies the language, and I don't know if we'll dig that far in the weeds, but we'll definitely look into it and we'll be able to get back to you.
Right. I know there is a way where they like, I wouldn't feel comfortable just willing land to a disabled person who's not able to pay the taxes, who's not able to, and it would throw them off the Social Security. It's like, so.
Right. I know there's different types of special need trusts that come into play here. And again, I don't want to misspeak, but I know it has something to do with special needs trust, and we'll be able to look into this deeper and get back to you folks.
Okay, thank you.
Okay, I'm going to move on. So since Colin, you brought in the Education Center, Kupuna Education Center, and reactivating it, I think, is this bill.
Yeah.
I do have the email.
Yeah.
So you want to say anything more about it? So you are, the proposal is to I guess it's on the book. So is it funding? Yeah.
It's funding to, right now, KCC has shifted from long-term care or elder care workforce development to community health workers, which is quite different. And there may be a need to find a home for this sort of program that wants to focus on workforce development for older adults, and so the infrastructure or the product itself or the work that had been done in terms of that can be continued to be implemented is in place. It just needs to find a home.
So tell me, what is the focus of the training? Because it's unclear. Are you looking at, it says long-term care caregiving, and is it the family caregiving, or is it the workforce development group that Caroline and America are working on are like CNAs, actual professionals, paraprofessionals? Are you talking about not the professionals and more like the Kupuna? What is the focus? Who are the beneficiaries of your program?
There's the CNA is the core, I think, but what I think this whole area is very dynamic. It's stirring right now, and what we were doing over at Kapiolani Community College was we were looking at even earlier, more basic types of training prior to the CNA, so from CNA or home care workers to personal care workers to companion aides and so on. So we're looking at a continuum so that depending upon the needs of an agency, and there's a possibility of hiring people at different stages of need, So, and then we were also looking at family caregiver training, which is also something that there's a need for a lot more of that sort of thing going, going forward. So anyway, this,
Okay, so you know what I would suggest, that you work with the workforce development working
Mhm.
group, because they have their program, as I understand it, is to give scholarships to students who are going through the training. But what you're talking about is the education center, which is a home for any of these kinds of programs and developing the program. So maybe you can look at what they're doing and what you're doing, so it's not duplicative.
no,
But
no,
it
no,
does
it should
provide-
not be.
Yeah, but you have to propose it in a way that, is it reactivating what's already there? Or is it a new program? And then you work with the community colleges, which I think Maricar and Caroline are doing, and see where it fits in and how you can support each other in doing that. So could you, it's a good program. Could you work with Maricar and Caroline and see how we can work with the community colleges to see where it gets placed?
Right,
Because
okay,
ultimately, yeah,
okay,
we have
I'll
do
talk
that.
to
So that's a
Caroline.
good program to activate it.
Okay,
Okay,
thank you.
thank you. Okay, moving on. Any questions on that proposal from it's really supporting and activating the Kupuna Education Center. Okay. So the next is the compassion, our care, our choice, Aubrey Hawk or Sarah Mans.
Aloha, everyone.
Hi.
Hi, it's so good to be back with Kupuna Caucus. I'm Aubrey Hawk. I'm with Compassion and Choices Hawaii, and Sarah Mans, who is the Hawaii manager, is also listening in with us today. Since we have the honor of 50 people on this Kupuna Caucus meeting today and many new lawmakers, just so thrilled to see everyone on this meeting. I wanted to just give a little bit of background about the Our Care, Our Choice Act. This law was signed in April of 2018, and it authorized a medical practice known as medical aid in dying in our state. Hawaii became one of 10 states now to authorize medical aid in dying. Medical aid in dying is a safe and trusted medical practice whereby a terminally ill adult with a terminal prognosis, that is 6 months or less to live, can request from their doctor a prescription which they can self-administer to end their suffering and die peacefully in their sleep. As we are living longer and living into many, many more years of our kupunahood, more and more of us, unfortunately, will eventually die with a terminal illness. And that brings many medical miracles along with it, but also can decrease quality of life at the end. And so the more options that we have, the better. So the Our Care, Our Choice Act has been in effect for just about 4 years now, since 2019, January 1st of 2019. And the law does work. It works quite well, and the but is only for those who can access it. Access to this law is incredibly hard, as it turns out. Not only is the law has 17 different steps that a terminally ill person must go through in order to, make sure that they qualify and cross all the I's and T's and I's. But it is really hard for people like me. I'm on the Big Island or in rural areas to access the law, to find a provider who is willing to help them and support them in this choice. So ever since the law took effect, actually, the first year afterwards, we have been going back to the legislature to fix the burdensome aspects of the law that initially may have been thought to be safeguards, but have actually turned out to really be barriers to access. So the bill that we are proposing again, and is very similar to what we did last year with the support from Kupuna Caucus, made it all the way through 6 different committee hearings, passed really with the majority, and then ended up dying in conference at the very last minute. So we know we have the support. This year, we are going back in with a very similar amendment to the law to take care of those access issues. One is to allow advanced practice registered nurses to be able to support their patients if they are already qualified, and they are, if they have prescriptive authority to do all of the different steps of the law. Secondly, we hope to allow the waiting period to be shortened. Right now, patients have to make a one oral request to their prescribing doctor and then wait almost 3 weeks, 20 days, in order to complete the process and make that second oral request. In between, there are all kinds of different steps that have to be taken. So we are hoping to reduce that waiting period to 5 days. Many states on the mainland who have authorized this are going to 48 hours. Hawaii has the nation's longest waiting period with 20 days. No one else has anything longer than 15 days. And that is already sort of an arbitrary number. Secondly, and related to that, we would like to allow the providing physician, the doctor that's writing the prescription, to be able to waive that waiting period entirely. In effect, it would be a 2-day waiting period with the time for the prescription to be filled, if in their professional opinion, the patient will not survive a waiting period. And unfortunately, that is what's happening now for about 1/3 of patients who already qualify and begin the process. According to Hawaii Pacific Health and Kaiser Permanente Hawaii data, they're seeing that 20 to 30% of their patients who want to use the law actually pass away before they can make it through that waiting process. And that is heartbreaking, because these people here are thinking they can access this law, and they end up dying in just the excruciating way that they did not want. So I hope to have Kupuna Caucus's support again with us. We have a lot of support from the nursing community this year, and we're ready to go back and get this passed this year.
Well, I appreciate your continuing efforts in this area, Aubrey, and also Sarah.
Thank you, Senator.
So are there any questions for Aubrey? Okay, we have supported in the past, so it hasn't changed. It's the same bill going forward. Because it did go all the way through. Okay, thank you very much.
So I guess real quick, Aubrey,
okay.
what does it pertain to? Does it include PAs, or is it what are we focusing on this year? Are we trying to do both?
We, as you probably recall, last year we went in, our bill strictly had APRNs. And the House, I believe, in one of the hearings added PAs. We're fine with it either way. PAs have to operate under an MD anyway, so they have that, they have that safeguard. We generally have just gone in with APRNs, but again, if PAs need to be in to make make certain segments feel good about it, then we're totally on board with that.
So you might as well use the last version, which would have included the PAs, yeah?
Correct, yeah. However, last year we were looking to reduce the waiting period to 10 days, I believe. And now we're going to 5. As the data come in from all of the states in the history in America, it's just showing that waiting period is really quite unnecessary.
This question about self-administration, though, becomes kind of challenging when you get down to 5 days if, the initial request was made when the person is still conscious. There comes a point when, morphine or, lorazepam or some of these other kind of drugs just do not work well enough. So, I'm all in support of what you're trying to do. Yeah, go for it.
Mm-hmm. Oh, thank you. Yeah, appreciate it.
So the only thing, right, that was the biggest issue last year was the PAs, right? So I think part of it is what you need to figure out if you're still going to be okay if we remove the APRNs, and we need to be clear about that at the get-go, because I think the House's position was going to be the PAs, but we really had to do a lot of maneuvering just to move it, right? And so we added it in knowing that the APRNs might get taken out. So I think you're going to have to give us some idea of what you're okay with. And you're going to have to understand that there is going to be some intense negotiations over this, because there was some really big outstanding issues, and that's why it died in conference that I don't think really got settled. So if we're going to be serious about this, we're really going to have to know who we need to talk to and how we're going to approach this. So we do have some work to do on this.
Yeah, you're absolutely right. We have already begun the groundwork with the different nursing leadership organizations who really backed this, but in a little bit more of a quiet way. And so they will be more front and center this session. And, you know, I mean, we're looking to improve this bill any way we can. You know, ideally, nothing has to drop out. Of course, we made it farther than we ever have, and APRNs were in there. So hopefully that is something that we can push for this time and is actually successful. And I would really welcome any of your guidance on how to do that.
So what Representative Hashimoto is saying, I think, is looking at what is your bottom line. If it is reducing the number of days and you want that, and if it's physician assistants, can the APRNs wait until you get what you want first and then come back in for who else can expand the base in terms of who can administer and approve. So, you know, again, looking at that as what you want to at least go forward, because doing the same thing is not going to help move it forward. So you might want to look at that. And it depends on who's on the House side, but the Senate was in full support, but it may change.
Yeah, and we are definitely waiting to see how the committees shake out on the House side. Who knows what it's gonna look like. But at this point, we are just all in again, because we know that APRN aspect of it will really move the needle in terms of access. And at this point, I'd rather not say, well, I'm just going to tell you, we'll be okay if that drops out, because we want to go for it.
No, I don't think we need to know now, but I think
okay.
Those are the things that you need to go back to your group and you need to think about. And I think you need to start communicating with key members, right, within both chambers, so they understand what this issue is, because I think that's part of it, is making sure it's front and center that this is an important issue. Because I think a lot of members, they didn't have that exposure, right? Because I think last year was supposed to be kind of a break year, right? We weren't going to push very hard, but we got it pretty close. So I think a lot of members were kind of like, oh, okay, what is this now, right? So I think that's very important on the education aspect.
Thank you.
Okay, thank you. I think, Kurt, did you have your hand up, or any questions from anybody? Okay, thank you, Aubrey, thank you, Sarah. We'll move on to Jim Sean. Is Jim Sean on? Okay, he suggests we go back in, looking at the reporting of the OCA, Office of Healthcare Assurance. And he did send in some information. Basically, this was done a couple of years back, looking at OCA hosting inspections and results of inspections. Excuse me. And so that's back on again. And we will give you links to the bills or drafts for you to consider. So next I have the Alzheimer's Association, Ron Shimabuko. I think I saw him. Yeah.
Hi, Senator Moriwaki. Good to see you. Aloha, Representative Hashimoto as well. Thank you for the opportunity to share our ask of the caucus. And before I do that, joining me is our Executive Director, LJ Duenas. He's also on the line. I'd also like to acknowledge the work that and the support that the caucus had done in the past to ensure that the Alzheimer's dementia coordinator position has been posted, is actually in the recruitment process. So we are very grateful and happy, all the efforts in the past had come to fruition. So, kudos to the caucus for making that happen, for your support. So our one legislative ask for the upcoming session is an appropriation request ask, and it is with regard to a public health campaign, and primarily on the preventative aspects of the disease. That is, if an individual experiences mild cognitive impairments, memory loss, etc., really to consult with your healthcare professional. And the premise for this is in that there are drugs very rapidly coming up on the market as soon as January that the FDA will make a determination on approving. So lecanemab is actually being decided upon on January 6th. And basically what it does is clinical trials has shown progress and positive results. So what it does is it slows the progression of the drug. So it's very important at this day and age, especially in the States, to get the message out to the community that, if you are experiencing these symptoms, to really consult with your healthcare professional early on. Our federal office is working on the federal level to address any challenges that come up with respect to the drug. I mean, obviously cost is going to be a factor, access, etc. So on the federal level, we're working and advocating with CMS to kind of remove barriers to access to the drug. But on the state level, we're really asking for support on an appropriation for a public health campaign to be done here in the upcoming year. And just some back history on this, Senator, if you don't mind. There was one request that was made of the legislature back in 2016, backed by the caucus as well, for an appropriation, which was unsuccessful. We do feel as if, it is a strategy contained within the Alzheimer's dementia-related state plan. So, we are very hopeful that we'll have funding this year to really carry out a good, effective campaign. And I'll welcome questions. Thank you for the opportunity.
Thank you, Ron. Any questions of Ron regarding the Alzheimer's information campaign? Okay, and you have an amount here. I don't.
Yeah.
100,000. Is that what you're asking for?
So, Senator, we don't have a Hawaii specific amount. However, we're still working that through. However, I will say that our colleagues in other states have provided us with what they've been appropriated with in the past. For example, Wisconsin had been appropriated in the amount of 500,000. So, we do understand, it's very costly to really get those televised television keyhole radio spots in media. So, and it can be very pricey. So, we are working that digit through. There also is an opportunity with federal funding through the Building Our Largest Infrastructure for Dementia, the BOLD funding, which is upcoming as well, which hopefully can be coupled, with state funding. So federal and state match in the same vein for the same effort would be definitely ideal and key to enhance, the messaging that goes out. So I'll definitely circle back with you on that figure for Hawaii and let the caucus know. Thank you.
Okay, great. Thank you. Any questions? Okay, well, thank you, Ron. We'll move on to Hawaii Healthy Aging Partnership. Michio Tomioka.
Hi, everyone. Thank you, Senator Moriwaki and Representative Hashimoto. My name is Michio Tomioka from University of Hawaii. I'm a coordinator for Healthy Aging Partnership. And as you guys know that we've been asking for appropriation every year. And unfortunately, we weren't able to get the funding for past few years. And so during the pandemic, we have seen that a lot of seniors were isolated and also physically declined. So we need to keep them healthy so that we don't burden other medical care. So Hawaii Healthy Aging Partnership has been offering 2 evidence-based programs. One is called Enhanced Fitness, which is a group fitness exercise developed by University of Washington. And gradually we have been starting in-person class, and everyone who came back to in-person, they really enjoyed. And so there, and also Maui County has been offering virtually. So that's one program. And then another program that we offer is called Better Choice, Better Health. And it's a chronic disease self-management program and designed by Stanford University. And this program helped the seniors to live with chronic condition and communicate with doctors better and other healthcare professionals. And this program has been offering in-person, phone and virtual and online formats. During the pandemic, we were able to offer non-in-person format. And we started to looking at offering in person, and also we trained a lot of people in cancer programs. So the program target the people with the cancer. Then also we trained some of the people for diabetes programs. So we're targeting the people with diabetes. So that's why we want to. Well, as an evaluation finding, we saw that a lot of improvements and many get the health benefits. And so people had improved physical performance and reduced ER visits. So we see healthcare utilization has declined. So that means we're saving medical costs. And that's why we want to ask for state appropriation to get your support so that we can offer the program continuously.
You're muted, Senator.
Thanks. Who administers? Is it the Center on Aging at the UH, or do you have the ADRC, or where do they?
So it's a collaborative endeavor with the EOA, Executive Office on Aging, Department of Health, Chronic Disease Branch, and UH Center on the Family. We three are the leader, and then all the area agency on aging are coordinating their county implementation.
And is it virtual, or you have sites in each county?
We offer both. So it depends, the county coordinator, some counties still, careful about offering in person. So those that county offer virtually.
Thank you, Michio. Any questions of Michio?
Yes, Senator, this is Barbara Service.
Hi,
I
Barbara.
wanted to ask Michio, I heard something today about 808 Fitness. Could you say what that is, please, Michio?
That's run by EOA. I think that's a TV program offered by Executive Office on Aging. So it helps some seniors who doesn't have access to virtual classes or in-person classes. So they can hop on to, is that KITV or?
KHON2, yeah. You got it right.
Yeah. So they can get on TV and doing exercise by watching TV.
Thank you.
Thank you. Okay, any other questions of Michio? Okay, well, thank you. Thank you, Michio.
Thank you.
Okay, the last one I have is Representative Martin. Easy way for Kupuna and Social Security to, I thought I saw Representative Martin. Oh, there she is. Hello. Hi. You want to explain your proposal?
No, I don't have a proposal. I'm just listening.
Oh, I thought I saw something from you. No? It says
no.
easy way for Kupuna and disabled on Social Security to get tax rebates, food tax.
Oh yeah, I forgot that I had brought that up as this. Yeah, it's not necessarily just Kupuna, but Kupuna that are on Social Security or people that are on Social Security because they're disabled would qualify. I'm not sure if you folks were experienced this, but with the recent rebate, basically if people don't file taxes, they don't get it. And I tried to help some people in my community who were actually disabled and kupuna file their taxes. It is very, very complicated. And there's a lot of legal barriers. For example, I couldn't just do it online for them. Legally, I had to go through a nonprofit, Vita, who does not make house calls. So I went and I had to fill out very complex forms and get original, photos of original Social Security cards, IDs, income statements. It was much more complicated than it is for people that actually pay taxes when you just do it online and they just believe you when you put in your Social Security number. We had to get a new Social Security card issued for one of the people. So instead, I have proposed, and I've been talking to the Department of Taxation, a very simple half-page form that basically says, I attest that I don't owe any taxes and I would like any sorts of credits or benefits that I might be eligible for. In doing this, I realized that this family, which is, four kupuna in the household, they were not getting their food credit, which is $110 a year. Actually, one of them who had worked part of the year also got, had income tax withheld, but she didn't make enough to need to pay taxes. So they ended up as a family of four getting $2,400 back, which is quite a bit. So anyways, I wanted to make it simple and automatic. I don't know what kinds of credits besides the food tax credit will apply in the future, but my thought is no matter what it is that the state comes up with, that form would include it. So it would just be comprehensive. And if we end up having, for example, a carbon cashback fuel bill pass or, something like that, the people that need it the very most can, in a simple way, get what everybody else is getting.
Great idea. I'm going to turn to Caroline. Do you know if there is, so Representative Martin is saying that the DOTAX did have a simple form that could be used, but I don't know is across the board, whether they could add in food tax credit as well as other tax credits in a way of reporting for seniors or for just anybody, actually. Have you worked on it, EOA?
No, but I mean, that's something we'd be happy to work with Representative Martin on.
Yeah,
I think it's a good
I just wanted to be clear, there isn't a simple form right now. It was
so what was that you mentioned that there was?
Oh, no, we want to create a simple form.
Oh, okay.
Yeah, right now I had to, with these people, we had to fill out a 4-page document for each person where you're never really sure because you don't understand the question. You think you don't have that, but you're not sure. So it was kind of a stressful experience. And I just want to make it simple. Yeah,
that sounds good. So yeah, maybe you could follow up with DOTAX. I guess it would be taxpayer services. How can you make it simple? Was that federal? That's federal rebate.
No, it's state. It's state, and DOTAX is actually helping me write it.
Okay.
Yeah.
So why don't you bring it back to us when it's done? And we'll see if we can add it on to our list.
Thank you so much.
Thank you. Caroline.
Senator, did you have any other
I have one more. I just saw Rick Tabor has one of his hearing aids update.
Yeah, I just want to let you know that in PABIA meeting today, the legislative committee, we decided that we're going to table it this year. So there won't be a bill this year, mostly because the over-the-counter has come out and we need to assess better what the needs are going to be going forward. So we've enlisted help from Kaylee and AARP and Kirby Shaw from DCAB, and I just asked Judy to help also. So we're going to gather more, if you will, Hawaii data around the hearing aid. What I've been sharing with folks is more national, and you know that well, Senator, and the representatives here that have seen stuff. So we're going to get more local information, and we'll be ready next year with the bill. Okay, thanks.
Very good. Thank you. Anybody else with bill proposals that we haven't covered? These are all the ones that came in. Caroline.
My apologies, Senator. I don't know where the two that we sent over on Wednesday went.
What was it?
We had two that came in. One was for our state health insurance and assistance program, and the other one was for our senior Medicare patrol.
Oh,
I
don't have it here.
we
but
do
yes.
apologize that we got it in on Wednesday, which was the deadline. The reason being is that these were not ones that were picked up in the Department of Health budget, so we wanted the opportunity to present it.
Why don't you go
Kupuna
over
Caucus.
them, then we'll include that. So go over each one of those and then.
Okay, and I'll make it quick. Okay, the first one is for our state health insurance assistance program, and that is to help support additional staffing to expand the program so that individuals either signing up for Medicare for the first time or want to change their plans, or an individual with a disability can get free, unbiased help and counseling with a very complex thing we know as Medicare. So we're asking, the ask is for 3 full-time equivalents to expand this program. We've been serving this population now for over 30 years. It has doubled in size. When our program started, there were 133,000 Medicare individuals. Now we're up to 285,000. And again, this is unbiased. So we are not being paid by plans or benefits. This is truly unbiased, free legal counseling to individuals on Medicare. So that's the first one.
And how much is that? 3 positions?
That one would be for 192,000. 408, sorry, $192,408.
Oh. Okay, I have it here.
And I did rush it over. I got to put the amounts in and I can resend it to you.
No, we have it. We just got it right there.
Okay.
Okay.
And similarly,
amount.
I know that's what I'm saying. The amounts weren't in there. So
Okay.
redo it and I'll send it over to you.
Right. Okay, and then the next one, I know we've run out of time, so I want to just cover that one and then see if anybody else has anything.
So again, that's for a senior Medicare patrol program. And that one is also to increase the staff size in order for them to be able to expand education and assistance to the growing number of Kupuna in our community. I can probably take a show of hands who has not gotten a scam call. So this is to really help protect our Kupuna who are more trusting and have the propensity to be scammed in a greater sense because they are trusting, and these people prey on their vulnerability, and we want to be able to protect these individuals from being scammed and having to go on to other programs and supports because they have now lost everything that they've worked their whole lives for. So we do want to, that one would be for 2 full-time equivalents, and that would be probably in about around probably 100. I'll have to get the exact amounts. I have to do the calculations on that, but probably about 140,000, 130, 140,000.
Okay, well, thank you, Caroline. Anybody else with a proposal? Diane Tirada.
Hi, Senator. I just put in the chat. I don't know if there's any plans or if there's any possibility to resurrect the bills to expand the state rent supplement program to provide funding specifically for seniors. Yeah, we're seeing more and more seniors who are at risk of losing housing. For some reason, there's a bunch of landlords that are starting to renovate their units, and the seniors are getting put in a position where they're probably going to lose their housing because the rents are going to go up and can no longer afford the rents. And we are seeing seniors who, because of the cost of other things in life, food and other things, are really struggling with the rent. And so if, seniors really are at have a harder time applying for these programs just because a lot of it is online, and just getting the information is difficult. And so if there was a way to sort of protect a pot of money for them so that it would be available to the seniors to prevent them from becoming homeless or to help those who are already homeless, that would be really helpful. I'm not quite sure what happened last year. The Senate bill seemed to have almost gotten to the end. So there must be something that's preventing it. And I haven't gotten any, I don't know what it is, but we know from our work with the seniors that it's tremendously needed. Thank you.
Okay, thank you, Diane. Anyone else?
I think that so real quick, Senator, I know that's one of our priorities, like personally, Senator, and my priorities. And so, you know, if Kupuna Caucus wants to do it as a placeholder, I think we would appreciate that. I think we can slip it in. We're not quite done with the bill. I think that we're going back and forth and we're trying to figure out the iterations. But if that's can be a priority of the caucus, I think we should put that as a placeholder and we'll come up with the bill. It's still in progress. So we'll probably get it a little later, but I think worthy cause, definitely a worthy cause.
Great, thank you.
Okay, I think we've come to the end. So we have, as I see it, 14 bills. So what we're going to do is identify the bills, and if those who presented can give us a copy of the bill, just send it to us digitally so we can link it so people can see the bill now. Everybody has heard the intent of the bill. And if you have, the more you have on the bill, we'd like to see that. And we've got some time and then everybody can vote on it. So what we will do is list all the bills, give you links so you can study it some more. And we will give you a voting sheet and everybody has a chance to vote on it. And we will then rank it, and the top 5 will be the Kupuna Caucus bills that we will support. But as we have done in the past, all of them are good bills, so we will proceed to support them. But as part of the Kupuna Caucus package, there will be 5 top ranking bills. So that's the process. We will give you information on the bills. You can vote on it, and probably by next meeting, we would have the listing and we could go forward from there. But the more that you can give us information on your bills, the better it is in terms of and there are over 200 of us. I don't know how many of us actually vote, but we all have the opportunity to vote. And as voting in the general election, we encourage you to vote, but read through the bills and see what they do. Pretty all of them are meeting a need that we see is important. So it's a matter of how do we get those that are really, especially the ones that ask for money. We need to look at that and consolidate if can. That might be helpful as well, but we'll leave that up to all of you as we go forward. But you can get the specifics on the bill. We will send you a list of the bills and the links, and then we will give you a deadline, probably beginning of next year, end of the year.
So I think what we'll ask is that, frankly, we're not sure how much the House limit is going to be from years to year. At one time it was 10, it went down to 5. We don't know if it'll ever go back to 10, but I think really we know it's going to be 5. So we'll know the top 5 will be Kupuna Caucus bills, but we'll ask probably, maybe we'll give everyone 10 votes just in case, and then at least we'll know what the ancillary other priorities are, like a tier 2 priority, just in case we have more bills. But I think if we don't, as Senator said, I think we can just say it, this is a KC priority, and we can find people to introduce them, especially with all of our new House members that are now here. But we do want to make sure we know which ones are priorities so we can get them out to members quickly, because members only have, from the House side, a 20 bill limit for personal bills. So those slots will fill up quickly. So we need to make sure we slot them as soon as we can.
So on the Senate side, we're unlimited, but it's a dangerous place to be. So we still need your input as to what are high priorities, because, you know, you could introduce the bills and it could, you know, sit there too. So you might want to look at that in terms of the justification on bills and why they're important to go forward. So even if they're not on top 5 of introductions part of the Kupuna Caucus, it's still important to go forward with them. So I see Kurt. Kurt has one last question.
One last comment. So Senator, I've been involved in the industry for a while. I'm a general contractor and an aging in place specialist. And during the beginning part of the meeting, there were 4 categories you had mentioned. But what I did not hear is any category regarding housing and accessible housing, modifying homes, because it impacts every one of these categories and every kupuna, everyone with a physical or cognitive issue. So I think maybe in the future, we should have some type of category that addresses housing. I have colleagues that I work with on the national level, and we're looking at submitting a bill. It was in Congress for a short period of time, impacting the cost of housing and home modifications for accessibility, where it would be a financial benefit and probably being in the tax department on the tax benefits of modifying your home to age in place, which will reduce the cost of Medicare, caregiving, and so forth. So I think something I would like to discuss with you further, and maybe Representative Hashimoto, and go from there. Because it's something that we need now.
So
Actually, maybe years ago.
I think we had an assisted living bill last time, and we did not bring it up, and nobody brought it up. And the way we operate here is everybody submits to us proposals or their ideas, at least at this meeting. So perhaps you're new to the caucus. So if you have that, and if that is something you want to put through, and you have some kind of proposal, you can add it on, and you just heard from you as to what that might be. Then if you give it to us within the week, we could add it to the list, and you have something there, people can look at it, and at least it would be vetted by this week.
Okay, yeah, I think that would be a good process. Although it's not assisted living, it's more modifying the home that you live in.
Okay. Well, whatever that is, give us the.
And I'll start from
proposal
there.
Yep.
Okay,
Thank
you.
So everybody heard the last one. We'll add on modification of housing so you can age in place. So if you give that to us, we will add it to the list and send it out, but give us some kind of description, or if you have a proposed bill from your national office, you can send it to us and we will send it out to everybody.
All right, thank you.
Okay, anything else? Representative Hashimoto, anything else?
No, thank you everyone for sticking on, and be sure to vote. I think that's important.
Yes, vote. And thank you, everybody, and happy holidays. We will see you in the new year. Thank you all very much for all your service.